Let's see. We both got. Oh, I'm gonna move the camera. Say hello.
Hey, good morning, everyone. It's been a long time since I've done a Facebook Live and Instagram Live with Dr. Kiltz. He's fixing the cameras here. There he is.
Hi, everyone. Good morning. Good morning. Good morning.
Good morning.
Dr. Kiltz and Dr. Faruqi, CNY Fertility, Facebook, YouTube, and Instagram Live. And we're glad to be with you today. It looks like our Instagram is working today.
Yes.
Exciting. We're going to do approximately an hour live, the Fertile Fireside chat. And at 11 o'clock, we're going to be with Dr. Ken Berry. He's the author of Lies My Doctor Told Me. He's really focused on keto, anti-inflammation, and carnivore. So we're going to end at a couple minutes before 11 and then start back up on YouTube and Facebook. So we're really excited about that. JJ Patterson, Samantha, hello. How are you doing?
And we got to say hello to Shelby.
Oh, and Shelby.
Yes, Shelby, yes.
Our entire staff, CNY Fertility staff at all of our locations, and really doing an awesome, amazing job, and grateful. Forever Grand joined, hello. Loca Bonita, hello. Kabal Kanda, hello. Heather Page, Anna Giffen, how are you doing?
Camille, hello, Camille.
All right, elaborate on betas rising. First was 72 and second 74 doubling rate. So in actuality, the HCGs don't necessarily need to double in 48 hours. It's 1.5 times. So if it's 50 2 days later, technically, let's see, 1.5 times 50 is 75, right?
Yeah, that's good enough.
And that's kind of, but even if they don't rise normally, stay on your meds and you got to ride it out a little bit. We've seen very low HCGs, 80, 70, 100, 120. Suddenly they show up as normal. So one of the things I'm reminding all of us, you got to stay with it. So Anna, thank you for your, hey, Raymond, Brother Ray, how you doing? Brother Tom, Sister Maria, Mom and Dad, to all of us, family, friends, loved ones, those that we don't know. It's a village. We're a human village in this globe, and all of us together with faith in God and the higher spirits or whatever that vibrational energy, it's all together. Samantha,
Can someone transfer 2 embryos to missing the rest?
Can they for first transfer?
Oh yeah, you can.
You can.
It depends on your age. It depends on the quality of the embryos. What's your history prior to you coming up to that transfer? It's really an individualized decision between you and your doctor. We actually don't have any rules. We adapt to you.
Guidelines we really work towards. And so we'll talk with you and your partner, and we'll help you make the decision. MZ Queen,
Yeah.
B, hello.
Hello.
Let's see. Coach Chanel. Coca Chanel. How can I get twins? Ovulation induction, more than one egg, but we're working to minimize to 1, but we'll discuss with you. And I think we do talk about 2 for sure. Camille Hellert, how are you doing today? Start Lupron and esterase today. Is it okay to take Leuprolide at the same time as Omnitrope?
Yes, it is.
It is. It is.
Yeah, it is.
It is. All right. Let's see. Oh, Dr. Faruqi's got a shout out.
Yeah.
And
I know Kelly.
And our Montreal team, really amazing. And we're grateful. We're really working to do better at all our locations. Sarasota is opening as a monitoring. We still have to get more equipment and more things and more construction. Let's see. HCG of 11, you got to stay on your meds. You got to keep going.
I've seen babies with 11.
We have, for sure. Yeah. Let's see here. Tips on getting my lining better for transfer. Not getting trilaminar, 7 millimeters.
It's not 100% a rule that it has to absolutely be trilaminar. Sometimes it's an ultrasound situation. It's how your uterus is positioned. So there's more to it than just
settings,
the millimeter, the trilaminar. If you're getting to 7, I'm thinking you're pretty good. Because
things like Neupogen, things like PRP, low-dose naltrexone. Wait. What's the most important one Kiltz is going to talk about?
Keto, of course.
Kiltz's Keto Lifestyle. And remember, at 11 today, we're going to sign off and then back on with Dr. Ken Berry. So tell your friends and family members. He's got over 2 million followers or near that. But, he's just such an excited, and his wife, Nisha, really brings some really great tips in all of this. But I would say that
So it's lies my doctor told me? Doctors.
Are you telling me a lie?
No. Do doctors tell lies?
Well,
actually, they don't. But sometimes we say things that they teach us, and then later on we question it.
Well, I think what we're doing, we're
it is.
learning what we thought we knew was right before isn't right today.
Correct.
We always have to be movable and changeable. And I think that's really, really important. Transfers in Atlanta, Dr. V's up here the next few days. We're really working on getting at least a transfer lab in Atlanta. That's what I'm working on, number one. So excited about all the stuff we have coming down the pipeline in 2022.
Yeah.
If
there's a good question there, Jordan. If it's 2 PGT tested embryos, presumably they're normal, can they be transferred together? The first transfer, Dr. Chang told me no. And answer, we also try to avoid that. Very high risk of twins, and
there are a lot of guidelines and rules, and it's really kind of a craziness. And we certainly don't mean to go against what you would love, but that one rule for the first one, the second one, again, it's not solid. We'll work with you, and we're open to discussion. Buffalo location is doing PGS. Holly Veers, 85. Yeah. Yes, they are doing it. Our Buffalo office is smaller, and so they can only do so many cases. So sometimes it's going to overflow to either Syracuse, Buffalo, or even Colorado.
Albany, maybe?
Yes, I meant Albany.
Yeah.
Albany.
The patient, when we do this PGT testing, we biopsy the embryos, we send the material out to a genetic lab. So the actual testing of the embryos is done by a third party, Cooper Genomics.
Right. Cooper Genomics. We biopsy it. We freeze the embryo. We keep it in whatever location you had your biopsy at, and a small piece of material. And then, I always keep my embryo trophectoderm biopsy sample, where any biopsy you take may get a different answer. So you have to be careful. It's not always 100%.
No.
And so we have to be open to the fact that,
truthfully, we're not biopsying the embryo. We're biopsying the cells.
Well, we're biopsying a part of the embryo, but not the inner cell mass, which is the fetus to come.
Yeah.
Cindy, good morning. Jordan transfers one day. What can I do to change? You mean about one or two? Again, we're just all working together, and we're going to do our best and be open.
Yeah. Let's tell you that there is a problem with twins. Twins is a high-risk pregnancy. The majority of twins are delivered a month early, but there is
or more.
And there's at least a quarter of the twins that are delivered so early that the babies end up in intensive care units. Not all babies, when they show up there, come out of there completely intact. So there is a lot of risk going through with twins. You're way better having 2 babies one by one.
Let's see. Dr. Vidali and I did a live last week. We're going to see who's going to be our special guest next week. We're going to have one. We'll do our question and answer live at 10, a special guest at 11. So we're working on Sundays, a 2-hour. So excited about that. So just more to come as we're really ramping up for 2022, making sure affordability, quality, access stay there. One of the point, Dr. Vidali and Pregmune, Pregmune, we're still working out the kinks to make sure you're getting the testing done properly, getting the proper report, and then we'll help decipher the report in all of that, which, again, there's the cost of the report, the cost of the testing, and then there's some cost of evaluation and a conversation. I'm a healthy 42-year-old, Liz, 192. Let's see, healthy, 42 regular cycles, 3 failed embryo transfers. Immune testing came back high, anti-beta 2, and 21 of 21, MPV at 13.5. Can adding anticoagulants help? Yes. And so Lovenox, heparin, Fragmin, aspirin,
immune protocol,
Plaquenil. And if you go to the other side of this is the CNY Fertility Family Building Guide. We have a new one coming, but if you look at that, you'll see the immune protocols, and usually 3 or level 4. You can look at that. It's about page 70 something, depending on which your version. You can go to the CNY Fertility website and click on resources and look at that, pass it around, share it, and remind the nurses and the team, hey, I'd like to do that. And if they say, well, you have to talk to a doctor, clinician, you say, wait, Dr. Kiltz on the live said, you can ask one of the practitioners, can we add that? We do Plaquenil or Prograf separately, not together. And I prefer Plaquenil 200 once or twice a day, Lovenox 30 to 40 twice a day. If you're getting to level 4, and things like IVIG and Humira can be very, very helpful. All right, Dr. Faruqi, second transfer after a cesarean.
That question comes back a lot. Whenever you're ready, actually.
I recommend 3 months,
Yeah.
just like we do myomectomies 3 months, and a C-section, even a vaginal delivery. Some people might push it to 6 months, but I think that's adequate in my opinion.
Especially with patients who are a little bit older. The other question is, there's nobody really wants a second transfer within the first 3 months of having a baby. You're so, you got your hands full with this little baby.
Bundle of joy, yes. Yeah. So the first beta pregnancy test, technically you're 4 weeks along. So consider the retrieval ovulation at 2 weeks along. The embryo transfer is 2 weeks plus 3, 4, or 5 days up to 6. And then the pregnancy test is considered 4 weeks. And we usually do the first ultrasound 5 weeks. We should see a sac in the uterus. And by 6 weeks in general, we should see a heartbeat.
And the reason they do that is because the majority of people who get pregnant don't know when they ovulated. They know when their last period was. So when we say that this baby was born at 40 weeks pregnancy, really the baby was 38 weeks old.
Right. And
so that's why it's a little bit confusing.
I'm confused a lot.
Oh, well, we're always confused.
Is everyone doing well today? This beautiful morning, Sunday. So grateful. Indigenous Peoples Day of the world celebration for all those that have suffered in this world. We need to support and be more upbeat, positive, faithful, and spiritual every single day. All right. I'm currently doing IVF at another clinic, insurance
coverage. I would like alternative protocols that you have.
PRP, intralipids.
Do have to be seen by CNY or use the same resources. Well, you got the book here. There you are. Just use the book.
And talk to your doctors. If they have questions, they're welcome to call me, 315-416-9872. But we'll be glad to help you through a consult or follow-up on the immune protocols. They're all in our books online on Amazon. Please feel free. Really a nominal investment to help you in all this. We're maintaining affordability, quality access, payment plans for everyone. And again, we're very, 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 very grateful. How long will I stay on antihistamines after positive beta? What do you say? I usually go 8 to about 12 weeks.
That's where generally I stop most of the meds around 10 weeks. Because by then the placenta is taken over. Actually, even the hormones that the placenta produces also have immune regulation, and so you're pretty much in good shape by the time you get there.
Yet one of the most important things is your hormones are supporting your pregnancy, yet inflammation is rampant throughout your pregnancy and beyond. I recommend stay on low-dose naltrexone. Stay on Kiltz's Keto Lifestyle. Remember, lifestyle means a low carb, high fat, 1 meal a day, lots of faith and patience in all of this is really important. But I would say that in many cases, we're going to stay on Lovenox, aspirin throughout pregnancy, LDN, intralipids weekly to 12 weeks, every other week to 28 weeks, and then maybe once a month. But stay as Kiltz's keto as possible.
So here's a good question from Lovely Smile. I'm in Philadelphia and would like to get started with your clinic. So if someone's not from here? How did they get started?
Well, in Philadelphia, Dr. Ivanov in our CNY Fertility Center is there for monitoring consults and getting you started. If you need surgeries, Dr. Ivanov is there. And so it really is, we're working to put sister clinics in all of our cities of this country and the world. We can work with your OBGYN to help get you onboarded, but a lot of what it's doing is simply starting with the fertile fireside chats, and
you can make an appointment with one of our providers. We do phone consults all day long. It's really very easy. There is no obstacle to coming to CNY. That's by design.
Absolutely. Let's see here where we had some betas. 170, 9 days, probably about 9 days post 5-day transfer on Friday. Been cramping and spotting on and off. Worried about another chemical. Make sure you stay on all your meds. Get a urine and check. Make sure you don't have a urinary tract infection. Again, Kiltz's Keto Lifestyle, because if you're eating a bunch of vegetables and things that are raw, they can ferment in the GI tract and cause inflammation. If you're going to eat any vegetables, cook them well, add the fat, but get that checked and make sure that it's nothing serious going on. Up the steroids in many cases, I think, and the baby aspirin, stay on that. Those can be helpful things, and get off the treadmill.
Hey, Rob, can we do an ERA and a hysteroscopy at the same time?
Yes. Yeah. ERA, Receptiva DX. CNY Fertility Centers do Receptiva DX. Remind the clinicians, Dr. Kiltz said, we can do it. My bias is that a laparoscopy, hysteroscopy is an important diagnostic therapeutic tool for those that are suffering from infertility. We want to make you as fertile as can be. High volume PRP intrauterine flushes out the tubes, reduces inflammation in the peritoneal cavity. I think that can be very, very helpful also. Let's see. You want to get this Sierra Sunderland.
My husband has had 2 semen analysis with low count, put on Clomid and HCG shots, went to freeze a collection CNY and the count was 0, referred for a TC. What else can he do since the meds made it worse? Actually, maybe the meds did not make it worse. It's just that he might have a blockage or something that's preventing the sperm from coming. So that medicine will also help during the TC.
And look at these sites. So one of the things I recommend for guys is Kiltz's Keto, low-dose naltrexone, CBD.
Supplements too.
Well, the molecular fertility. Thank you, Dr. Faruqi. Our male fertility supplements.
Those really work.
Yeah, and the omega-3 fatty acids, DHEA, I think is really critical. My brain is having a little bit of a moment. HCG 250 units sub-Q daily for up to 3 months or a little longer, plus Clomid 25 or letrozole 2.5 can be very helpful to build the sperm. Then you do a biopsy.
That's what the gentleman is doing.
Right,
so
right.
You're doing the right thing.
But before you get the biopsy, start the meds. Kiltz's Keto, Me Carnivore, the Lion King plan is #1. And again, we're going to be talking with Dr. Ken Berry, who's helped eliminate hypertension, diabetes, and so many other diseases. And fertility just like shows up.
And we see it every day. It's not just something that we're promoting. We actually see it. And there's a lady right there.
I'm just promoting it.
Yeah.
Okay.
Kensington. Go ahead, Rob.
Let's see. Kensington Meister. So excited. Found CNY. I have my second appointment in a couple of weeks. I have my appointment in a couple of weeks. A second opinion. Started keto plan a week ago, and I'm already down 6 pounds and feel incredible. Look at this concept is radical. I'm working on Dr. Kiltz's Keto Lifestyle. Really excited to be talking more about it. And I only talk about it because I too suffered bowel bleeding, arthritis, psoriasis, kidney stones, migraines, craziness. And now
that hasn't been cured.
I was going to say I'm more sane today than ever before. But, ever since I discovered Ken Berry, Marie Emmerich, Sean Baker, if you look at Gary Taubes, Good Calories, Bad Calories, there's so many ideas out there that you'll learn. And my theory, Stephen Gundry's book on the plant paradox, plants or live organisms that want to kill us and disrupt our reproduction. And I know you think I'm nuts, and I am, but it works. Mandy Smothers, 14.9, 9 days. Listen, carnivore works. And look, we all want to lose some weight, but I say don't lose it. Use the weight. And technically, I'm sorry, fat is the only fuel for the mitochondria, never sugar. Insulin resistance doesn't exist. You don't go from burning sugar to burning fat. We just don't understand the workings of the miracle machine, the Ferrari. That's what we are, and that's what we're energized to share each and every day. And so there's so many great fertility doctors out there and practitioners. Plus, there are plenty of people on the alternative side, right? Acupuncture, massage, naturopaths, nutritionists, sharing ideas. I got to share. Let's see, where's the book? Oh, Judy Cho. It really has a great book on carnivore cure. My first book on Kiltz's Keto Cure. I changed the name because then when you write the word cure, people don't like it. But some really radical concepts and ideas. I call it the baby's diet: bacon, eggs, butter, beef, ice cream, intermittent feasting, 1 meal a day, and salt. All right. And you remember, it's ice cream is from time to time, not all the time, but faith is first. All right, Dr. Faruqi, you want to add, let's get another question here.
Okay. We're looking at priming. I have 2 retrievals with 1 embryo each. Both transfers failed. What supplements should I start? That's a good question too.
Well, it may not come in so well on the Instagram. I apologize. I think, but it's molecular fertility supplements, female, male, ovarian bloom, which will really help. Cerevital. I know Dr. Magarelli loves Cerevital. It's I think you get it on Amazon or online. It's a omnitrope human growth hormone supplement. What other things are we going to talk about, Doctor? Kiltz is keto. And it really is radical and amazing. Michaela Peterson, Jordan Peterson's daughter, really has some great stuff on the Lion Plan and carnivore. I think it's water, salt, and beef. And it's narrow, but I have done it. It's amazing. It's a game changer. So the supplements are, if you go to our website, cnyfertility.com, look at the family building guide, look at the supplements also. They're all very, very, very helpful. If you have sperm at another location, another clinic, absolutely, we can work with that sperm, work with those eggs, work with those embryos. And we too ship egg, sperm, embryos to other locations, and we're here to help. Dr. Trussell is amazing. We have much lower costs of doing your aspiration of sperm. We can freeze it and ship it wherever you like. So Dr. Trussell is really, really amazing. Here's a good one. We're gonna put this on the board. Caitlin Beers, Dr. Fruki, do you want to read that?
I've had 2 twin losses, 1 singleton and a chemical pregnancy, PCO, but haven't gotten any reason for the losses. RPL normal. That means that the workup was normal for recurrent pregnancy loss, except slightly elevated NK cells. Did intralipids and still had a chemical. That's a kind of case that we would really like to do, analyze one by one, but you have lifestyle changes to adapt to. Kiltz keto, we have immune protocol, and that, by the way, actually, we've seen a lot of pregnancies, people who have failed multiple times, who've even lost babies during their pregnancies, and then we did that protocol. The second case here, we would leave you on the immune suppression way longer, continue the intralipids, but it really, really works. We do a lot of cycles. It is very easy for us to see a difference when we start doing things a little bit, when we tweak our protocols. So definitely immune protocol is the way to go. That would be the number one reason we would give you immune protocol.
So PCOS metabolic syndrome is pre-diabetes. It probably is diabetes in a level that most of us don't even understand. My theory, again, is if we eat 3 to 6 carbohydrate-rich meals a day, fruit, fiber, vegetables, seeds, and nuts. Anything that isn't an animal or bug is a plant essentially. And so that causes metabolic disorder, glycation, damage to the glycocalyx, which is crazy, amazing concepts and ideas. But the one thing I've learned is that this is where you do higher dose Lovenox twice a day. You do Plaquenil twice a day. You do prednisone 15 to even 20 twice a day. Look at Prejmune with Dr. Vidali. I'm really excited about that. And carnivore keto, I'll bet you $1 billion. It's the game changer. And the other is laparoscopy, hysteroscopy. That can be very helpful. And PRP, HCG, washes, and Neupogen, I think can be very, 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 very helpful. Let's see. Oh, Vanessa Rodriguez. Let's see. So many have shared the CNY Fertility support groups on Facebook. I know YouTube, Instagram, all of this. Remember, we're the village. All right. All of us are part of this really important village. So do not give up on this journey. All right. Zim, you want to read that, doctor?
Stillbirth at 21 weeks. I'm ovulating day 15 to 18 millimeter follicles. My husband's sperm is excellent. We've been doing timed intercourse. I'm having issues with implantation. I've had a few chemical pregnancies. Last one was the previous cycle. Your thoughts? I went keto after reading Keto Feast. Felt amazing for 2 weeks, then major reflux and flu like.
Your body's fighting you. This is normal. It's just that's normal, those symptoms. Don't give up and give it time and patience because we are addicted to sugar and plants.
Yeah, it's like a heroin withdrawal.
It's heroin withdrawal. And so stand strong, work to be as keto as you can. Carnivore is number one, in my opinion. But again, it's really, really hard, but anyone could do easy.
So the question is, if you're doing intercourse and you still want to have some sort of an immune modulation, low dose naltrexone can be taken. Baby aspirin.
Well, Lovenox, plaque. We'll do all of these things, whether you're working to get pregnant through natural. But this is where, again, if you go right to the Family Building Guide on it, it's free. You could download a digital copy, but it has that long list of all the things that you can do to this. Again, watch our lives, read our website. Again, my bias is you have late ovulation, you have metabolic syndrome, PCOS-like. Again, I don't like these labels, but you have prediabetes 100%. And by continuing on this journey, but it takes 2 to 4 weeks to get keto adapted. Now, really what that means is that you're withdrawing from the sugar. You don't go from burning sugar to burning fat. That's not keto adapted. Keto adaptation is that now you're realizing you're getting your body into a lower glucose environment. Again, you're withdrawing from coffee, from nicotine, from caffeine, from alcohol, from any of these drugs that are the culprit, which all of them incite inflammation in our bodies. And our bodies are the miracle machines. You're the most expensive, valuable, irreplaceable entity ever in the universe. And you need to realize and take time to read and listen and learn, but never, ever, 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 ever give up. You need a coach. This is where the support group, the Fertile Secret, the Fertile Spirit, Fertile Hope Yoga. There's so many coaches out there in this fertility space that sometimes you just need to talk to someone, listen to someone. You get a chance to watch these two crazy guys that are sharing some thoughts and ideas that'll get you your successes in. Do not give up. You don't need to do IVF or IUI. You simply need to keep on the journey, have faith, and don't forget the vision board. The vision board is the game changer. That's kind of the fun part, right? Don't lose the vision.
How soon before transfer can I do an HCG wash? What about? I generally do it once I start progesterone at some point.
Yeah, anywhere between 1 and 5 days is usually good. Even at the retrieval, if you're doing a fresh transfer, in my opinion, you could do a PRP HCG wash for sure. How long should I be on keto prior to starting FET again? Savvy Sav. I'd say 2 to 4 weeks is the best. Kiltz's Keto Lifestyle. Again, with your vegan, vegetarian, Mediterranean, pescatarian, or carnivarian. It's all there. And 2 to 4 weeks, I think, is good. In just a week or two, you'll feel better. Look, we're all addicted to sugar. I love French fries. I love cake and cookies. I love Kiltz's ice cream. What I practice doing is having it from time to time as a reward and not cheating in any of this, right?
Yeah.
Never cheat. All
Yeah,
right.
last night
We had I made Snake River Farms, the American Wagyu ribeye for my friends. And I made French fries, fried in duck grease, dipped in mayonnaise, and let's see, Faiz Sandikel, who's in his second year of medical school, helped me make the ice cream. And I have to keep Dr. Fruki away from the French fries before they're on the plates because he eats them all first. But again, life is meant to be a reward, but you need to take care of yourself like the Ferrari first, right? 3 miscarriages. Let's see. DM Jarrett.
Jared.
Can you read that?
My husband and I have had 3 miscarriages. We have ovulation issues. My husband now has antibodies he produces against his sperm, and they stick together. We've done 3 IUIs now. Have you been investigated for your recurrent miscarriages? Have you had an ultrasound, a sono, hysteroscopy,
laparoscopy, Prejmune testing?
Yeah.
Are you doing Kiltz's Keto Lifestyle? Are you making the changes? I think that, don't give up. This is where low-dose naltrexone, CBD, omega-3s, it's where
once again that famous immune protocol. Because once we do this testing, we only find causes in a certain percentage of cases, but the majority of cases we feel are inflammation, immune.
They're all immune related.
Yeah.
We'll find, and even the cases where we find a translocation abnormality balanced on either the male side or the female side, plenty of those people have babies in their family history who carry those genes. So there's something else that's a cofactor in all this, and it's inflammation. And that inflammation is really, really simple. They call it idiopathic infertility. We're idiots. We're sometimes kind of our heads in the sand. We really are finding new and different. And as I've learned from Ray Emmerich and Ken Berry, Sean Baker, Paul Saladino, and so many others, we've learned the game changer. Do not give up. Have faith. Faith first, and fatty fertile foods second will lead to your fertile life. And whether you're working to have a baby or you're working to be creative and excited in something else in life, do not give up. But it is amazing. My bet is that you're going to have a baby,
For sure.
whether it's natural IUI or IVF or whatever, acupuncture, massage, meditation, yoga, prayer. So now I always say no exercise. And really what I mean is no excessive exercise. What you want to do is be creative. I get on my bike a little bit. I enjoy getting out when I get down to Florida. I enjoy light weights. Mostly I enjoy getting into my pottery and painting studios. And love to write and love to share video. It's really great to share these things. We both are pilots. We love to fly airplanes and practice and really, really, really always learning every single day. Lexi Ray.
When you're doing something and it's not working, you need to change. You need to do something different. I think lifestyle changes is huge. It's a huge component.
Every day.
And it's vastly underestimated.
Every day.
The value of lifestyle changes.
Every day.
Changes everything.
And really, that's the whole purpose of Kiltz's Keto Lifestyle and CNY Fertility Family Building Guide. Look at my Fertile Feast book. Remember, it's there for everyone, whether you're a vegan or a carnivarian or somewhere in between. The most important part I call intermittent feasting. Many people call fasting. I don't like the intermittent fasting. It's fasting 1 meal a day. Fasting 1 meal a day at night, that's the game changer in my opinion. Let's see here. Oh, this is a good one. Andrea Hodges.
I'm supposed to start estrogen on cycle day 21. If I happen to conceive naturally, what do I do, as I don't know, obviously, before starting? Clearly, you don't know. But estrogen is absolutely not dangerous. It's the exact same hormone that your body is producing. By the way, we give estrogen in embryo transfers and
all the time.
Well, almost all the time, because we do sometimes natural, but even then it's estrogen. So there is absolutely no danger.
It's actually, it may be helpful to use estrogen, progesterone. My bias is I like in our priming estrogen, progesterone. I like prometrium or endometrium, plus omnitrope, human growth, cerevital, sometimes, and always keto and the supplements, the molecular fertility supplements, I think are really, really helpful. So the whole game plan here, we want you to get pregnant naturally. That's the one thing about CNY Fertility. We do natural, we do ovulation induction with letrozole clomid injectables. We do fresh and frozen. We do PGS and non-PGS. We do immune protocols and non-immune protocols. But ultimately, you're the driver on which way to go, and we're here to help you 100%.
Dr. Kiltz, I was tested on the 6th, Wednesday, and came out negative. However, my regular monthly period 7 days late. It's been 4 days since I stopped my meds. Is there a possibility that I might be pregnant? Well, depends.
Possible, yes.
Probable, no.
Possible, yes. Yeah. Let's get you a pregnancy test, an ultrasound potentially. Let's see where you're at, and then let's go from there. So late on a menstrual period is not unusual, but sometimes the first test is falsely negative. It's not as common, but get the ultrasound blood work.
You might have done it a little bit too early, and we were unable to detect your HCG, and now we will. So certainly, at the very least, repeat the test.
Yes. Yeah. Ultrasound blood work. I recommend a vaginal abdominal ultrasound. Look at the lining, look at the follicles, the ovary, and then look at the blood work. Many times we'll do this blood work. It's just a baseline to tell us where you're at. It's not supposed to say, yes, you can do it, or no, you can't. All right. Stephanie, how does PRP help with getting pregnant, and how successful is it?
Well, first of all, what is PRP?
Platelet-rich plasma. It's an extraction of your blood. It contains many stem cells, anti-inflammatory particles that help reduce inflammation in our bodies. By flushing it into the uterus, it flushes out the tube, it reduces inflammation, and it may help the stickiness of those stem cells. They're going to help latch onto that embryo that's coming down the pipe and get rid of the excessive immune cells that are adversely affecting sperm, egg, embryo, and that implantation environment. Does that kind of answer it?
Yeah, and does it work? The answer is actually yes, it does work. Number one, we see a difference in the endometrial thickness, quite remarkably, and we have so many cases that when we start doing things, we can actually see differences. So the answer is yes, it does work.
So I don't know if you guys can all see this. This is inside the back of Kiltz's Keto Lifestyle. It's a good list of a lot of the references in the books that I've used and learned from. But look at the Family Building Guide. It's on our website. You can download a free digital copy and look at Kiltz's Keto Lifestyle. But there's the Fertile Feast, the Fertile Secret, Living Your Best Life. I think I've sold 2 copies. Did you buy one?
I just stole one.
Okay.
Did I have to pay for it?
Yeah, you have to pay for everything. Kim G, how are you doing? The great, amazing global team, the travel team, the financial team, all of them really, really doing an awesome, amazing job.
How many people work for us?
Well, infinite. And I'll tell you why. Yeah. Look, we have about 400 staff, many of them new, learning, really excited, but we're a village of infinite providers, and you guys know as much or more than many of us. Bring what you know, because that's medicine today.
Help us help you.
Every day.
Yeah.
Every day. Let's see. LDC dog. I think that's it.
Yeah.
Elevated BC16, no endo found. Inflammation is often hidden and isn't visible. Hydrosalpinx fluid as well, but no tubes. They removed them. Lupron still be used a few months prior to. You can use the antihistamine, the antimicrobial, and the anti-endo. All of those things may help reduce inflammation, along with, Kiltz's Keto Lifestyle for fertility, But remember, it's Kiltz's Keto Lifestyle for a fertile life, which is about reproduction, but it's also about a reproductive life. That's where we really want to be building this for
It's
everyone.
when you're the healthiest that you reproduce the best.
Mind, what we put in the mind and mouth, and how we move the body, and that's really the key to all of this.
Oh, that's a good one.
Brittany,
Brittany Marie, if my husband's sperm is very low and doesn't have much mobility, is IVF still a chance for us? Absolutely. That is the treatment.
even if there's no motility in the sperm, it can be used with IVF, with the ICSI, which is our standard approach anyway. But don't forget the male supplements, HCG, maybe some Clomid.
A big cause of male infertility is, well, actually, I can say inflammation, or more scientific, it's called oxidative stress to the sperm.
Glycation.
Yeah.
But remember, a plant-based diet contains estrogen, progesterone, and testosterone. All of those hormones come from plants. They suppress the egg function, the sperm function, and they cause infertility. That's the craziness. Again, look at Stephen Gundry's book on the plant paradox. But this stuff, look at Kevin Stock. I quoted Kevin in our book. He's a dentist, really amazing blogger, and shares some really great ideas. PRP need to be done 6 to 12 days after a cycle. PRP can be done at any time of your cycle, in my opinion, if you're doing it to help with your fertility at any stage. So if it's intraovarian or intrauterine, I generally recommend some antibiotics be given for 5 to 14 days, depending on the methodology there, to reduce the risk of subsequent infections, which are rare, but they can happen from any of these treatments, by the way.
How long is that the one? Yeah. Okay. How long after a polyp removal should I wait for a FET? That's Shauna Wilson asking us that question. Not that long, because when we remove a polyp, depends how easy it was, but probably the next cycle.
I would do it. Yeah. Sometimes we'll actually do a hysteroscopy DNC polypectomy the beginning of your cycle, start estrogen, and prep you for a frozen transfer right away. So I think those are all reasonable things to do in this. You guys are all amazing, and thank you very much. Again, at 11 o'clock today, we're going to be signing off a couple of minutes before 11. I'm going to be signing on with Dr. Ken Berry, and the lies where is it going? The lies my doctor told me. He's a YouTube sensation. He and his wife, Nisha, share some really great ideas on keto and carnivore and how to eliminate hypertension, diabetes, many other inflammatory disorders that most people don't even quite understand. And again, most of us doctors and practitioners think it's mystery, it's toxins, but in fact, yes, it is toxins, but the actual mystery is it's from the plant-based diet we're eating. That's the crazy part.
AMH level of 1.5, would you consider that as a diminished ovarian reserve? All depends on age, but it's just one reflection of a reality, and there's no number that actually prevents pregnancy. Actually, they have actually done studies. There is no correlation with your AMH level and your probability of a pregnancy.
Yes. Although we know that the lower numbers tend to have a lower probability. Let's be realistic. The truth is that there are people with lower numbers that have babies and higher numbers that don't. Tisha, I wouldn't say that. I would say that's a good number. AMHs can go up and they can go down. They can change. They do based on the substances that we put in our body and our exposure to things in our life. So we have to really be careful on how we're emulating that, by the way. And we're also, by the way, we're going to be signing off on Instagram and coming back, but unfortunately you will only be able to hear us. So I really recommend going over to the CNY Fertility Facebook or YouTube channel to be able to listen and watch Dr. Ken Berry and myself coming up at 11 o'clock. Let's get in there.
Quarter to 11 right now.
Let's see. Cytotech for miscarriage. How long after can I transfer? Beetlejuice.
Yeah. So you have to get back to a negative pregnancy test, and that could take a couple of. Even though Oh, you're stealing my water here.
Yes, I am.
So after a miscarriage, even if we do cytotech and we repeat your ultrasound 10 days later, say, and we see nothing in your uterus, that means that the procedure has worked. Your pregnancy test is still positive for a couple more days, perhaps even a couple more weeks after that. As long as your pregnancy test is positive, nothing really can be done. And then when it becomes negative, you get a period. And from that moment on, we can go back and do another transfer. Average time to negative is about 3 to 6 weeks, depending on how high it was before. Do you have any other question here?
Yeah, go to the next question, doctor.
Let's see. Boy, there's so many questions coming. It's just flipping around.
Yeah, there you go. Right there.
All right.
There.
Okay.
Nope, not that one. Okay.
Oh, this is a
Brother Ray.
Okay. Brother Ray. All right. Yeah, that's a good one. Does being on Orilissa and letrozole make sex uncomfortable? After my laparoscopy and hysteroscopy and DNC, starting Orilissa it almost hurts to have sex. Any suggestions? Well, the reason why it's uncomfortable is because both Orilissa and letrozole lower your estrogen levels. You were put on that most likely because you have endometriosis. We're trying to reduce your inflammation by cutting off the fuel, which is estrogen. Well, unfortunately, the secondary effect of that is less estrogen also causes vaginal dryness, and it can result in this kind of discomfort. So if you can talk to your provider, there's all kinds of things. Add back local estrogen we can give you. So there are a lot of solutions. You don't have to suffer through this.
Yeah, and I'd say sometimes we'll add back a low dose estrogen. That's really helpful.
Especially if you start getting, basically the medication's working really well on you, maybe even a little bit too well, but we can add back and make it a very tolerable situation.
Liz 192 on our Instagram. And again, a shout out and hello. Tell us where you're coming from, where your home is. We always love to hear that. Let's see. What is the success rate for a 3BC and 3cc embryos? Number one is I don't recommend grading an embryo as good or bad. We've seen the worst looking embryos become a baby and the best not. They're always moving. Embryos are moving. Yeah. It's, I take 10 pictures of him. He deletes half of them or 3/4. No, 99% of them.
I always look bad.
Yeah, true.
Like you say, if I was an embryo, they'd have thrown me away.
Yes, but our mother kept him, didn't throw him away.
Yeah.
And I always say I was an ugly embryo. They would have thrown me out. But ultimately, judge not lest ye be judged. We've seen so many beautiful embryos.
Amazing.
And ugly embryos. So we've seen 3BC and 3cc make beautiful babies. The idea that we can predict a number is a 1% chance of a beautiful baby worth transferring that embryo, or is it only, it's a 99%? I would say transfer away.
Trying to grade an embryo is like being a stockbroker trying to time the market. It just doesn't work well.
All right. Escobar, La Chula 22, Virginia ER nurses, and to the nurses that are amazing providers of health and wellness and dealing with many challenges. We just shout out to all of you for the amazing work you do. And so if there's damage, so sexually transmitted disease, in my opinion, is one small cause of a damaged tube. There's so many bacteria, yeast, and viruses, and the majority of inflammation, I think, comes from the fiber in our gut, the plant chemicals, the sugar. All of these things are there. And, laparoscopy, hysteroscopy, selective tubal catheterization, Kiltz is Keto Lifestyle. Again, whether it's Barry or Emmerich, and a shout out for Maria Emmerich, by the way, on keto foods, right? So look at Maria and Craig Emmerich stuff. They're amazing. Shout out for carnivore. And Maria and I just came out with a book, the Fertile Feast Cookbook. There's so much there that I see reduce inflammation, but laparoscopy, hysteroscopy, selective catheterization, in some cases, laparoscopic repair of a damaged tube could work. Depends on the age. The younger you are, the better the ovarian reserve, the more time you have in giving that. But at any age, and whatever it is, you have the right to say, hey, I would like to look at doing this in getting my success. All right, 5 more minutes, then I'm going to come back with Dr. Ken Berry. Thank you so much. Brenda Lee, what would be the benefit of orless electrical part retrieval versus not if laparoscopy already done?
It's the same. It's what we had just discussed a few minutes ago. Reducing inflammation. Laparoscopy helps us diagnose it. We can also remove it during the laparoscopy, but a lot of times this inflammation is microscopic. We don't see it, but by doing a treatment like that, we're addressing the areas where there is an effect from that inflammation in a more global way. So yeah, it does have a complementary effect.
For sure. Having trouble getting an HSG locally, talk to radiologists, but it's not mandatory. You get a hysterosalpingogram, by the way. Talk to your local OBGYNs. If not, we have people that come to Colorado or Syracuse or Albany or Buffalo.
Atlanta?
Not yet. We're not doing it in Atlanta yet, but we will be. Let's see. There was another question here on, let's see. Do I have to wait on financial to get back to me before starting? You don't need to. You can go online and pay your payment for and get on a payment plan. We're working on that and making it more efficient and easier and better for you. So do not give up. I had a BB and I have a pregnant at 30 weeks. Awesome. Share your stories. Share your video stories. Really, really important. The sharing the stories, because ultimately we love to be around. I got to make sure that everyone we'd love to be around the fire and tell our stories. Dr. Fayez and myself and some good friends sat around the fire last night, shared stories, and that is really critical for all of us. And if you're sharing your pain and your positivity also, there's really critical. And going to therapy, I mean, I go to therapy, and I think it's so important to talk to a coach, a cheerleader, a therapist that can help you sort of lay it out. Get yourself a journal, write down your feelings and thoughts. And the most important part is never, ever, 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 ever give up on the beautiful miracle machine, your humanness. Okay.
And by the way, therapy is not just seeing therapists. Therapy is talking to friends, being with your family. It's like what we did last night. We had therapy.
Sometimes our families can be a little challenging, right? Sometimes our friends can be challenging. They do things that piss us off, right? And we go like,
I never pissed you off.
All right. There was a question. Noel, having a blighted ovum twice common. Remember, a blighted ovum, a miscarriage, an unknown location of an embryo are all related to only one thing: inflammation. The cause is the same. It doesn't matter what the disease is or what the stage of the loss is, or the failed implantation or the failed getting pregnant. It's all inflammation. It's all one thing. And the most common is that oxidative damage, mostly from glucose, because we eat a high glucose diet. Remember, fat is the fuel for the mitochondria. Acetyl-CoA comes from fatty acids. Sugar and proteins must be converted to fat in order to fuel the mitochondria. We have it all wrong. Insulin resistance does not exist. And we don't go from keto burning sugar to burning fat, in my opinion. Sweet Cake Red, how you doing? Escobar, hello. You guys are awesome. Let's see. Sarah,
on Wednesday. When does implantation occur? Not feeling anything. Well, you don't have to feel much when you have a frozen transfer. When does implantation occur after a frozen transfer? I would say shortly thereafter. We actually don't know the correct answer to that.
It may be, it's sort of, you think about it, when lint sticks to your shirt, right? And you just can't get it off. So there's these it's like static electricity. It's all electromolecular forces that are actually the first line in all this. It may take moments to minutes to have some stickiness of that embryo. Remember, the glycocalyx is a sticky layer and a mucus layer. The things that are meant to stick because of the electrical charges are very critical, but it takes moments, minutes, hours, and days. And this is one of the things I believe, that even when we inject a sperm into an egg, fertilization may not occur until the next day. So when we see an unfertilized egg and then the next day we don't see anything, you got to wait another day or two, in my opinion. And so all this implantation, we have to be really.
There's so much we learn when we start doing IVF that changes the way we thought.
Absolutely. And the fact that so many people who do IVF get pregnant, have a baby, then get pregnant naturally. You always have to have faith. And Brother Ray shared, you always have to have. So let's see if I can point right. It's always love. Okay. Love always overcomes everything. Our challenges, we need to love what we hate. The hate will become the love that we can see that'll heal us all. That's the most important part. Does someone's weight play a big factor in IVF? My answer is no, it doesn't. The thing that causes the problem is the inflammation within our bodies due to the diet and the lifestyle. 2 to 4 weeks of changing the fuel and getting all that stuff out of the bowels, the fruit, the fiber, the seeds, the nuts, the vegetables will change it. The reason the data shows that weight matters is because all of those that have an excessive weight got there because their diet is excessive in a high plant, a high frequency of food, and a low fat diet, which is deadly. 2 to 4 weeks, you can change it up. Look at Emmerich's keto, Kiltz's keto, Barry's keto, and all of these things. It's really amazing, these ideas. But never, ever, guess what? Give up. Have faith first. Slow it down. Cool it down. If you're going to do exercise, light and easy. Find some way to be creative and make something that is going to be like, wow, I did that. A lot of ugly art is often admired as beautiful and amazing. And that's the game changer in all this. All right. So we're going to be signing off, coming back in about 5 minutes with Dr. Ken Berry and another hour packed of questions and answers with Dr. Berry on how keto, carnivore, or any form of keto will change your life, reduce the inflammation, and make you the healthiest and wealthiest.
And I have to say goodbye because I will not be coming back. I have to be heading back to
Montreal, CNY Montreal, and taking care of everyone.
Yeah.
And so let's see, Nora, having chest keloid is impacting implantation. Sure does, because keloids are evidence of systemic inflammation. Reduce the inflammation and you'll reduce everything else. All right, everyone.
Yep, and we love
See you guys in a few minutes.
Bye-bye.
Bye.